From a practical perspective, we need to know what happens to implants as they heal, and over time, we need to infer what's happening at that cellular level, or how is integration occurring, and how can we identify what's happening. This is a famous graph that comes from a publication about 15 years ago now that talks about primary stability and how it relates to healing. And if we look at the process as it occurs, when an implant is first placed, we have that primary stability. It's the implant in contact with the alveolar housing, with the threads or the undersides of the osteotomy accomplishing that connection. There's debris, there's blood cells, there are an initial fibrin network, which is these yellowish strands that form. And the implant, if you look at the stability, is at its maximum at day one when you place that implant. Through the healing process, we get a little resorption around the threads, we get some expansion of that socket, and the osteoclastic activity of the inflammatory process takes over. And then we start seeing a reduction in implant stability. As more time goes on, there is more resorption, and also we start seeing the apposition of woven bone. And then gradually this matures into fine trabeculae and ultimately into a healed, mature type of lining against the implant surface. So for every implant we place has to go through that process.